The Connecticut Hospital Association has adopted a statewide policy that endorses mandatory COVID-19 vaccinations for hospital and healthcare system employees and clinical staff. Joining us this morning to talk about all this, Senior Vice President of Policy for the Association, Paul Kidwell. Paul, I want to thank you for your time this Friday.
Thanks for having me. I appreciate it.
Yes, nice to have you here. And I know this announcement came into our newsroom yesterday. Talk a little bit about what motivated this decision. I know you've been looking a lot at the science.
Well, I appreciate the opportunity to talk about this decision. So our CHA has been obviously engaged in the response to the pandemic over this last many months. And as we continue to look for opportunities to respond to the pandemic, one of the ways that we can enhance patient safety and our worker safety is by ensuring that our workforce is vaccinated against COVID-19. We know the vaccines are safe and effective. We know that they have helped rapidly stop the spread of COVID in Connecticut, and importantly, have really reduced hospitalizations. So we want to make sure that our patients are as safe as possible, not just our COVID patients, but all our patients in the hospital. And we think this is an important step in that direction.
What do you think it means for actually getting shots into people's arms? How will this move the needle within the population you're working with?
Sure. So you'll recall that back in December of 2020, when the first vaccine was authorized by the FDA, the first population of individuals that were made eligible were hospital employees. And so we have really done a very good job of getting the vast majority of hospital employees vaccinated. And this next step, we'll continue to use the clinics in our hospitals to increase that percentage. We'd like to see it as close to 100% as possible, and that's why we took this action yesterday.
Paul, going off a point that you just made there, we know that our hospital personnel, rightfully so, among the first to be offered those vaccines. What might you say to critics who say, hey, it's taken a long time to get to where you are today with this decision? What took so long?
Sure. Number one, as we did with the public at large, we wanted to make sure our hospital employees had an opportunity to review information around the vaccines, have their questions answered, certainly their concerns raised. So over these last couple of months, our members, hospitals across the state, have really provided a number of opportunities to make sure employees have the information that they need to feel comfortable with the vaccines. Since the first vaccine was authorized in December, we have seen the data come in that shows that the vaccines are extremely effective in curbing the spread of COVID-19. And so now we think it's the appropriate time to take this next step.
Paul Kidwell with the Connecticut Hospital Association, please know we appreciate your time, and please come on back as news warrants.
Thanks so much. I appreciate it. Have a good day.
All right.